For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon, everyone. My name is David Campos. I'm the lead public information officer for the County of Santa Clara's Emergency Operations Center. Today, we are having a press availability with some key county leaders to discuss the announcement that was made by the state of California that allows the County of Santa Clara to move into the orange tier. As you know, we have been working in the last few days to prepare for this development and have put out a lot of information to our residents and businesses in preparation for this move. So with that, we're going to first hear from the County Counsel for the County of Santa Clara, James Williams, who is going to explain more about what this means, and then we will hear from our Public Health Officer, Dr. Sarah Cody. So, Mr. Williams.
Good afternoon, everyone. As David just mentioned, a little while ago, the state announced that Santa Clara County is now eligible to move into the orange tier under the state's four-tier framework. We were expecting that would occur, and in fact, last week issued a modified risk reduction order. That's the local county order that overlays on top of the state's requirements. That modified order will now go into effect tomorrow, Wednesday, October 14th. And that means that beginning tomorrow, there are a number of other categories of activity that can resume here in Santa Clara County. In anticipation of this, we also have issued a number of revised directives. These are the industry-specific guidelines that provide a safety framework for operating in a manner that is safer with respect to COVID-19. Significantly, there are two key areas where our local order will continue to have a different requirement in place than what is otherwise generally allowed under the state framework in the orange tier. And these are two areas that present greater risk of COVID-19 transmission. One is indoor dining. And for indoor dining, we have updated the dining guidance that is already available online. It was actually put up a few days ago, but it will now go into effect tomorrow. And the other category is indoor gatherings. These are both areas of greater risk. And in these two areas, in Santa Clara County, the numerical limits will actually be a bit stricter than what is otherwise allowed in the orange tier elsewhere for those counties that have met the orange tier criteria. So specifically, what that means is in Santa Clara County, for indoor dining, there will be a capacity limit of 25%. For indoor gatherings, a capacity limit of 25%. And for both, a total cap of no more than 100 people. And that's a really important limitation that we've put in place to help try to reduce the density, to help try to reduce risk for the community. And we will be out there with our enforcement teams ensuring that there's compliance with that local requirement and with the local directives. So again, a little different than what you'll see on the state website, because as has always been the case, wherever there's a difference between a state and local order, the stricter controls. And so in these categories, indoor dining and indoor gatherings, and gatherings includes, for example, movie theaters, the limit is 25% of capacity or no more than 100 people. Now for outdoor gatherings, the full state number in the orange tier of 200 persons will be allowed. There are a number of other important changes for businesses. Within the next 14 days, every business needs to submit an updated social distancing protocol. This has been for many months now one of our bedrock baseline requirements. It's the check mark that you've all come to expect now when you see or enter any business or facility. And we have an updated protocol. These protocols are available on our website. They are searchable, but an updated protocol to reflect the latest state framework and the revised local order. So it's really important that all businesses do fill that out and submit that and continue to adhere to the local requirements and the state requirements to help keep us safe. Now, I just want to say, moving to the orange tier is significant, especially given how large a county we are. And it's going to be up to us collectively in how we adhere to the safety protocols, the face covering requirements, social distancing, the implementation of these protocols, following the capacity rules. These are all essential steps in order for us to stay in the orange tier. And if we fall back in meeting the case count criteria and having testing that we have available in our community and the positivity rate that we have, if we fall back for just a couple weeks, the state will move us backwards into the red tier. And so as a community, we have made tremendous progress, but it's been slow and hard-fought progress. And so we want to really make sure that folks are aware that we need to continue to be very vigilant and thorough in adhering to these baseline safety standards and protocols. And with that, I'm going to turn it over to Dr. Sarah Cody, our health officer.
Thank you. Good afternoon, everyone, and thank you so much, James. I'm going to tell you a little bit about where we are in terms of the numbers to put our county in context, both where we are in this pandemic and where we are as compared to other counties in our state. So I think today is really great news for everyone who lives and works in this county and all of the collective work that everyone has done to move us into the orange tier. The orange tier, also called the moderate risk tier. And I think just to elaborate on what James said, this was hard fought. So remember that we went from the transmission levels that we're seeing today, sort of average daily case counts that we're seeing now. That's where we were in mid-June, and in less than a month, our daily case counts tripled. And since the middle of July, so that's almost 3 months ago, we have slowly drifted down to where we are today to meeting the metrics for the orange tier. But it took a long time and a lot of work. So here are the metrics that enabled us to be eligible to do these openings in the orange tier. We have an average daily case count of 3.7 cases per 100,000 population. The metric says that you need to be below 4. We meet that case count because it's adjusted for testing. We do a lot of testing here in Santa Clara County, so our adjusted case rate enables us to meet that metric. The overall positivity rate, the proportion of people tested who test positive for COVID across the county is 1.7%. But the state introduced a new metric today, the health equity metric, which says that the lowest quartile, the most disadvantaged quarter of the population, also needs to meet that test positivity metric. So that means that our most disadvantaged quartile needs to have a positivity rate below 5. And in our county, our most disadvantaged quartile test positivity is 3.8. So we meet that health equity metric. Also, really good news and a testament to the work that's been done in community with community to help prevent the spread of COVID. I also just want to put the work that's been done in our county in context. We are the largest county in the entire state to move into the orange tier. So the first large county to move into the orange tier in the state. And I think what that says is that we have been working extraordinarily hard in our county for a long time. We were a bit stricter for a bit longer than many other jurisdictions. I would say for in particular for the large jurisdictions in Southern California. And now that is paying off. We are able to cautiously move into the orange tier. I would just say that overall, what we have done here in the county is to always keep the health of the public front and center, and to make gradual tests of change to ensure that everyone is as safe as can be as we go along, even knowing that there's no way that we can prevent every single case of COVID. But we can prevent a lot of hospitalization and a lot of death if we go slowly and carefully, and that's what we've done. So even though we're certainly by no means out of the woods, and in fact all around us in many communities in the country, of course, we see COVID increasing, we think that with everyone's help, we can continue to prevent severe illness and death from COVID, even as we enable more businesses and activities to resume. That's going to take everyone doing a couple really simple things. One is always wearing a face covering, as we're doing indoors. 2, whatever activity and event you can do outdoors, it's always safer than indoors because you have natural ventilation. 3, more distance is better. So the fact that we're all spaced out here and wearing face coverings increases the prevention and keeps us all safer. So in closing, I think we're now switching from a strategy where we're controlling the environment by keeping a lot closed to shifting the responsibility to each of us as individuals to do everything that we can to follow those core principles of wearing a mask, staying in well-ventilated places, and keeping a distance. If we all do those things, I think that we'll be able to hold our transmission steady, or hopefully even continue to allow it to drift down. But as always, it's going to take all of us working together, and it's going to take all of us remaining vigilant. Even though we're tired of being vigilant, we need to remain vigilant to keep everyone safe and to keep making the progress that we've made. Thank you so much.
Thank you, Dr. Cody, and thank you, Mr. Williams. Before we take questions, we want to note that we are broadcasting live on Facebook, and that at the end of the question and answer period, we will be available to speak to monolingual speakers in Spanish and Chinese if the media would like to ask questions in those languages. So with that, we'll open it up to questions. Yes, sir?
I have a question for County Council. How are you going to get the compliance with restaurants, and how are you going to be fair, for example, with all the restaurants, especially Mexican restaurants, against another ones? Because you've been hitting Mexican restaurants very hard, and you haven't checked others that are not doing the protocols. So to be checking this, how are you going to do it? How are you going to handle that?
So we're going to turn this over to County Council. The question is with compliance, how are they going to implement compliance? And there is a claim that Mexican restaurants have been hit hard, but I would actually dispute that and note that we have actually gone after non-compliance with respect to everyone in the same way. And in fact, we have a very expansive outreach program that goes door to door, including to Spanish-speaking businesses. But I'll turn it over to County Council.
Yeah, sure. That's exactly right. We're doing a lot of work with our with the restaurant industry. We have specific guidance out there. It's actually a sector that the county normally regulates through the Department of Environmental Health. Those general health and safety inspections that you have for food safety on a day-to-day basis, year after year, that's a county function. So it's actually one of those areas of county jurisdiction even normally. And we've done a tremendous amount of outreach, and there's a whole outreach effort that's completely separate from any of the enforcement work. We do receive complaints. Those are followed up on. And a really important thing that I want to emphasize with our enforcement efforts is we have baked into the ordinance a process where people not only get warnings and they get notice and they get assistance, But they also almost always have a grace period to correct any violations before they have to pay a fine. It's only in those very rare instances, and it has been relatively rare, where it then moves on to actual imposition of a fine. But we are out there, unfortunately, the largest sector that has had complaints has been the dining sector, and we're very concerned, to be honest, about what might happen with opening indoor dining. We know it's a very high-risk environment. Dr. Cody has been pretty clear about actually discouraging higher-risk individuals in particular, but even folks more generally should really think hard about indoor dining, because it's an activity where you're inherently indoors without your face covering on for an extended period of time. And so we are very concerned. So we are going to be looking at those capacity limits. We are going to be looking at the adherence to the specific requirements of table spacing and the other criteria that are put in place to really try to make it safer. But I don't think anyone should be mistaken. Outdoors is definitely safer than indoors, and indoor dining is definitely one of the higher risk activities that is now going to be opening up in our county starting tomorrow.
So can you just clarify regarding enforcement, who exactly is enforcing, like, for example, that a restaurant is adhering to the 25% capacity? And can they possibly face fines, and what would the amounts potentially be?
Absolutely. So we have an enforcement team that's part of our EOC operation. It involves our Department of Environmental Health, which, as I mentioned, has general responsibility for health and safety compliance at restaurants anyway. And they work very closely then with my office, the County Counsel's office, to follow up and pursue and issue any notices of violation to specific facilities where we've got a problem that hasn't been corrected. The fines are a sliding scale, depends on what the violations are, how many, and they can add up. But an individual fine can be as much as, for a given violation, $5,000 per violation per day. But again, the goal of the program, I just want to be very clear, and we've had, in this community, we've had great compliance. And when we've had issues, they've almost always been addressed with that education and outreach or that warning. Now, there are exceptions, but they're the exceptions. So, I don't want people to misunderstand that. But it is there, and partly it's there as a matter of fairness, right? Businesses that are opening and following the rules and following the protocols and being diligent about it, it's not fair to them if somebody next door is not following those protocols. We understand and recognize that they're significant. It's really vital for health and safety, and it's also vital as a matter of fairness.
And can you just clarify, since we're on the same topic, you mentioned that restaurants need to submit an updated social distancing protocol. Can they still start operating tomorrow and then submit it, or do they have to submit it and get confirmation before they can start operating at 25%?
So two things. First of all, it's actually all businesses need to submit an updated protocol, not just restaurants. It's literally all businesses that are open in the county, and they have 14 days from tomorrow to do so. So they can go ahead, if they have a current protocol in place, that continues to be valid for the next 14 days to allow them to submit an updated one. But you cannot be open in this county without a protocol. So you either have to have one already from the prior order, or you need to submit a new one. If you don't have one at all, you cannot be open. But you do have that 14-day period to do a revised one.
Yes, sir.
Hi, good afternoon. Elliot Alvin, San Jose Mercury News. Thank you guys both for being here and answering some questions. This is for whoever wants to take it. I specifically want to ask about the sub-industry of collegiate athletics. We have two schools, Stanford and San Jose State, as you're well aware, that are practicing out of county because of restrictions. Going into the orange tier, what do they need to do? Can they start practicing tomorrow on their campus?
So this is on collegiate athletics. We're going to turn it to our county counsel, Mr. Williams.
So So that's a great question. We actually do have a directive specifically related to collegiate athletics that is now up and posted. It provides the criteria and requirements. It will go into effect also tomorrow as we move into the orange tier and as the new risk reduction order goes into effect. And it provides protocols around keeping small cohorts, around face coverings, around testing, and the other kinds of protections that will help reduce risk. Although again, kind of like indoor dining, people need to be aware that having direct physical contact with other folks, and that includes other teams that are going to potentially come into the community, right? That is higher risk, and so this helps put some safeguards in place, but it doesn't eliminate that risk. There is still risk. It just reduces it. And we have seen across the country a lot of outbreaks at college campuses, and so it's something that will really need to be carefully adhered to by our colleges here in the county. That's our expectation, and we've also made very clear in the directive that the authorization to proceed is contingent on careful, thorough, complete adherence to those protocols because it is high risk.
And sorry, to follow Jeff, does that mean tomorrow they can't just show up on campus and start practicing? There's still some hoops they need to get through before they can return?
They need to be implementing those requirements. So if they can do that tomorrow, they can move forward. There's testing requirements, there's cohorting requirements, and so forth. And those have been up for a few days now, and there have been a number of conversations with the colleges in our community. So, if they're ready to do that, then they can proceed. They don't need a specific approval.
We have a question over here.
Yeah, a question for Dr. Cody. I wondered if you can comment on some of the high-profile cases that have been in the news lately, with President Trump claiming that he's been cured, and the drugs and the therapies that he's been receiving, look to be successful. Is that what doctors are seeing here in Santa Clara County? And secondly, is there kind of a less severe COVID-19 that's circulating now as opposed to what was going on in February or March?
I can't speak to what's happening in other jurisdictions, but I can speak to what's happening here in our county. And what I've seen here in our county is at the beginning of the pandemic, we had a number of hospitalizations and a number of deaths. Now in this that was sort of our first wave, and our second wave, which peaked in mid-July, we had as a percentage, a lower percentage of hospitalizations and deaths, but it's almost impossible to tease it apart and to understand our local data because we were not doing much testing because the tests weren't available during our spring spike. In contrast, starting in June, we've been doing a lot of testing, really widespread testing. So it's difficult to compare our experience with the first wave and the second wave. But any time that anyone is sick enough to require hospitalization and that was preventable, we really do need to double down and do everything that we can to prevent it. And certainly any time that we can prevent someone from dying of COVID where it's a preventable death, we do need to do everything that we can to do that.
Dr. Cody, do you personally feel comfortable dining indoors? And for those who choose to do so, any additional advice?
I think it's really important to remember that any indoor activity where you have to remove a face covering is going to increase your risk. And so anyone who is in a higher risk group or who is in a household with someone in a higher risk group, we strongly discourage higher risk activities like indoor dining.
But for you personally, do you feel comfortable?
In my household, I have people in higher risk groups, and so for my situation, it is strongly discouraged.
So we're gonna
because it's higher risk.
We're gonna take questions from anyone else who hasn't asked a question. Okay, if not, we'll go back to this gentleman.
I have a question for Cody. There's two questions. One is, what if he's gonna play the music in Mexican restaurants? Because Mexican restaurants still don't know why having a stereo, having a DJ is affecting COVID. That's one. The other one is on patios. I had a patio on a restaurant on 13th Street where the patio was closed because it has 2 walls. They have to have 3 openings, that's what they said. But also in the same restaurant, when the inspector was there were 2 Mexican guys with a guitar that wanted to play on a table from the street, far away, 6, 7 feet away, and the inspector said, no, you cannot play music at all. Music is not allowed. Mexican restaurant, and this is cultural, we have to have music when you are inside a restaurant or outside.
Yeah.
So what that's gonna play now?
So I can start to answer your question, then I invite our county council to chime in. I sort of want to explain the why. When people are indoors with their face coverings off in order to be able to eat and drink, we want to still try to create an environment that reduces the risk. And anytime there is background music that's louder, where people have to talk over the music, that increases the likelihood that an infectious person would create aerosols or droplets that could harm somebody else. So we want to keep it fairly quiet. We also want to really encourage, whenever possible, to have people move their dining experience outside where we know that there's more ventilation, right? So if you had a lot of excitement and loud music inside, that would draw people inside to speak in louder voices, and that would be riskier for everyone there. James, do you have anything to add?
Yeah, I would add that we've actually brought more of that distinction to bear in the revised guidance between outdoors and indoors, and so more of an allowance for some of these activities outdoors than in the indoor setting for precisely some of the reasons Dr. Cody has mentioned. And also note that a little while ago, about a week or so ago, week and a half ago, we clarified the definition of outdoors to try to address some of these more complicated patio situations where there were different walls and other configurations to try to provide better clarity around that. But can't speak to a specific case.
We'll take a couple more questions. Yes, sir?
For James, could you outline very specifically what sort of gatherings will be allowed under the 100 person? Is it movie theaters at spacing? Is it churches at spacing? I mean, the common types of things that people would want to do at an indoor gathering. Parties, are they allowed?
Sure. So under the state's rules, indoor gatherings are allowed for only First Amendment type of activities or for business operations. So basically, under the state's rules, that allows churches, synagogues, other religious institutions. Under the state's rules, that allows protests and those kinds of activities, indoors and outdoors. But under the state's rules, that would allow wedding ceremonies, but not receptions, not birthday parties, not social type gatherings. Under the county framework, which of course is subject to that state limitation, what will now be allowed to happen up to the 100-person limit or 25% of capacity, whichever is lower. Churches will be allowed to happen indoors, church services, the movie theaters, as you mentioned, and all of the other types of gatherings allowed under the state. The only difference locally is that number being 100 persons, but otherwise the types follow just what's allowed under the state. Now I do want to note the state over the weekend did put out some revised gathering guidance for social gatherings. I think that was picked up by a lot of folks, that allows outdoor gatherings of no more than 3 households, only outdoors, not indoors, outdoor gatherings of up to 3 households for social purposes. So that could be to get together with friends, family, neighbors, outdoors, and they've got some specific safety criteria. That's also allowed under the county's outdoor gathering rules, but people need to, that limit of 3 households comes from the state.
So we'll take one more question. Yes.
Thank you again. I guess, Jeff, it's probably a question for you, following up what I've already asked about collegiate football. How will you monitor, now the state guidelines specifically say they have to have a liaison, each school, who is in charge of monitoring that. So are you relying on that state directive, and then you, the county, will work with that person to ensure that they are adhering to your directive?
So the question is, how will we be monitoring compliance with the collegiate athletics requirements? Yes. So the first answer is yes, they have to comply with the state directives, and so the state guidance that requires them to designate somebody, that applies. In addition, we have our complaint portal, which is applicable for compliance across the board. That's everything from our testing order to issues that people may see in businesses in the community, but also anything that might be happening with an on-campus program. And we have received concerns, for example, about different sorts of things, and including on college campuses. So that's another place where we can receive complaints, and we will then follow up on them. And then where resources allow, we do proactive outreach, and we do proactive monitoring to the extent that we can, and we try to focus those in higher risk settings. And as I mentioned before, things like indoor dining, things like collegiate athletics are among the higher risk activities. So they'll be an area of greater attention. But, if people see, I think a message for the public, if you see something that doesn't look right, if you see something that is not in alignment with these important safety protocols that are in place to keep all of us as a community safe, we encourage folks to report those concerns through the complaint portal. Let us know so that we can follow up, so that we can let people know, this is what the requirement is, so we can do the outreach, so we can help make things safer for all of us.
Thank you very much. And just for the record, it's James Williams, who is the county counsel, and then Sarah Cody, the public health officer. Thank you very much, and we're now available to members of the media who would like to do an interview in Spanish or Chinese. Para las personas que son de los medios de prensa que quisieran hacer una pregunta en español, estamos disponibles para esos medios de prensa. Thank you.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.